Here's a question: could you pass the same balance test? Many physical therapists use as part of a basic mobility assessment. Let's find out together. Your muscles, joints, vision, and nervous system all work together to keep you balanced. As we age, those systems naturally change, but that doesn't mean balance can improve. Let's begin with a simple test, and then talk about practical ways to support your stability. Point 1. Prepare for the test. Before you begin, make sure you're in a safe environment. Stand next to a sturdy countertop, heavy chair, or kitchen island that you can hold if needed. Wear supportive shoes or go barefoot on a flat, non-slip surface. Avoid thick carpets, uneven flooring, or slippery tiles. Remember, this is not about proving how strong you are. It's about checking your current level of balance as safely as possible. If you have recently fallen, experienced severe dizziness, or have been advised by your healthcare provider to avoid standing exercises, skip this test until you receive medical guidance. Take a deep breath, stand tall, relax your shoulders, and get ready. Point 2. The balance test. Stand with both feet flat on the floor. Focus your eyes on a fixed point straight ahead. Rather than looking down at your feet, slowly lift one foot a few inches off the ground, while keeping your standing legs straight, but not locked. Let your arms rest naturally by your sides. Try not to hop, twist your body, or grab nearby furniture unless you truly need support. See if you can maintain this position for up to 10 seconds. Then repeat the same test on the opposite leg. Some people will find this easy, while others may begin to wobble after only a few seconds. Either result is useful because it provides a snapshot of your current balance. Remember, this is not a diagnosis. It's simply a practical way to become more aware of your stability. Point 3. Why balance matters. Good balance allows you to walk confidently, climb stairs, step over obstacles, and perform everyday activities with greater safety. As balance declines, simple movements can become more challenging, increasing the risk of trips and falls. Point 4. What influences your balance? Balance depends on several body systems working together. Your muscles provide strength, your joints sense movement, your eyes help you understand your surroundings, and your inner ears assist with orientation. When one or more of these systems changes with age, balance may also change. Point 5. Leg strength plays a major role. Strong leg muscles help stabilize your body during walking and standing. Without regular activity, muscles naturally become weaker over time. Even simple exercises performed consistently can help maintain lower body strength. Point 6. Vision is more important than you think. Your eyes constantly provide information about your position in space. That's why balance often becomes more difficult in dim lighting, or when vision problems are not corrected with appropriate eyewear. Point 7. Certain medications may affect stability. Some prescription and over-the-counter medications may cause dizziness, drowsiness, or changes in blood pressure that can affect balance. If you've noticed new balance problems after starting a medication, discuss it with your healthcare provider rather than stopping it on your own. Point 8. Physical activity can improve balance. Balance is a skill that often responds well to regular practice. Activities such as walking, gentle strength training, tai chi, and balance exercises can help many older adults improve stability and confidence over time. Point 9. Don't rush your movements. Standing up too quickly can sometimes cause lightheadedness. Give your body a moment to adjust before walking, especially after sitting or lying down. Point 10. Make your home safer. Simple changes like removing loose rugs, improving lighting, and keeping walkways clear can significantly reduce the risk of falls at home. Point 11. Listen to your body. If you feel pain, severe dizziness, or sudden weakness during any balance exercise, stop immediately and seek medical advice if symptoms continue. Point 12. Practice the test regularly. One balance test doesn't tell your entire story. Your performance may vary from day to day depending on sleep, hydration, medications, and overall health. Instead of focusing on a single result, repeat the test every few weeks under the same safe conditions. Over time, you may notice gradual improvements as your strength and confidence increase. Small gains matter. Standing for just a few seconds longer than before may reflect meaningful progress, especially when combined with regular physical activity. Point 13. Build better balance every day. Improving balance doesn't require expensive equipment or long workouts. Small daily habits can make a difference. Walking regularly, performing gentle leg strengthening exercises, practicing heel-to-toe walking, and standing on one leg while holding a sturdy surface for support are all examples of exercises commonly recommended for improving balance. Consistency is much more important than intensity. Even a few minutes each day can support better mobility over time. Point 14. Know when to seek medical attention. While gradual balance changes can occur with aging, sudden or severe balance problems should never be ignored. If you experience repeated falls, persistent dizziness, fainting, weakness on one side of your body, difficulty speaking, or sudden changes in coordination, seek medical attention promptly. These symptoms may indicate conditions that require professional evaluation, and treatment. Early assessment can help identify underlying causes and provide appropriate care. Point 15. The goal isn't perfection. The purpose of today's test isn't to pass or fail. It's to become more aware of your current balance and take positive steps toward maintaining your independence. Every person ages differently, and improving balance is often possible through regular movement, healthy habits, and guidance from healthcare professionals when needed. Whether you held the position for 2 seconds or the full 10 seconds, what matters most is continuing to stay active, practicing safely, and giving your body the support it needs to keep moving confidently for years to come. If you found this video helpful, don't forget to like, subscribe, and share it with someone who may benefit from trying this simple balance test. Thanks for watching, and I'll see you in the next video. Point 16. Healthy lifestyle habits that support better balance. Balance isn't improved by exercise alone. Your daily habits also play an important role. Staying well hydrated helps maintain healthy blood pressure and may reduce lightheadedness when standing. Eating enough protein supports muscle maintenance, while foods rich in calcium and vitamin D contribute to bone health. Getting 7 to 8 hours of quality sleep allows your brain and nervous system to function at their best. If you wear glasses or hearing aids, make sure your prescription is up to date, since both vision and hearing contribute to balance. Finally, schedule regular checkups with your healthcare provider, especially if you've noticed gradual changes in your mobility. These simple habits may not produce overnight results, but together they can support better stability and help you remain active and independent as you age. Point 17. Track your progress over time. One of the best ways to stay motivated is to monitor your progress. Repeat this balance test once every 2 to 4 weeks, under the same safe conditions, and write down how many seconds you can comfortably maintain your balance. On each leg, you may notice slow but meaningful improvements over time, especially if you're practicing balance exercises consistently. Don't compare yourself to others. Everyone ages differently, and progress often happens gradually. The goal isn't to achieve perfection. It's to reduce your risk of falls, improve your confidence, and maintain the ability to enjoy everyday activities safely. Small improvements today can make a meaningful difference in your mobility and independence. In the months and years ahead,